Hello everyone, welcome to Yashoda Hospital's online segment Know Your Doctor session. I'm Dr. Lakshmi, and in our today's episode we have with us Dr. Vamsi Krishna, consultant pulmonologist from Yashoda Hospital's Malakpet. Welcome doctor. So doctor, tell us more about yourself and your journey in this medical field.
Hi everyone, I'm Dr. Vamsi Krishna Mutnuri. I'm a consultant pulmonologist at Yashoda Hospital's Malakpet. I have moved to Hyderabad recently from my hometown to pursue my career here at Yashoda Hospitals, which is the most sought after destination for pulmonology as well as interventional pulmonology in the whole of South India as well as India.
So pulmonology, what made you choose this field? Was this by choice or by chance?
It was definitely not by chance. It was by choice. Pulmonology is something where you can directly serve the public, because as we all know, pulmonology basically deals with tuberculosis, and it was the only branch which dealt with tuberculosis previously. Now we have so many other diseases which come into the purview of pulmonology, but TB is the most common entity we see even today in the day-to-day practice. So there are millions of cases of TB in India, and we all know there is a high burden and prevalence of TB in our country. So I thought I should be a part of that service and a campaigner as well as a warrior in trying to end TB in India by 2025, or whatever goals the WHO usually set for us to eliminate and end TB.
So doctor, talking about various diseases in pulmonology, what is your opinion about the current COVID variants which we are seeing? Is that something to alarm about?
Yeah, right now I don't think there is any alarm, because we have seen the worst of the COVID in the last 1.5-2 years, and right now all of us are a bit relaxed. Right now there is a fifth wave starting in South Africa with variants called the BA4 and BA5. We have been hit by the Omicron, which is a BA2 variant. So we never know if we are also going to see another wave with the BA4 and BA5 variants in the near future. But that is unpredictable, because we really don't know how COVID behaves, and that is the reason for all this chaos we are facing today, even with all the kinds of preparedness we have in our hands. Now that we have relaxed from COVID, there is a lot of rebound partying, revenge partying, revenge vacations and all. It is not completely right to say that it is wrong, because we as human beings have the tendency, but it is definitely good to be on the safer side. And if something like a pandemic again is starting somewhere in the world, and if there is a potential that it might to come to India as well, then maybe we should be more alert, and we should brace up ourselves for any upcoming COVID wave.
I think we are all better planned now as far as pandemic is concerned. So talking about pandemic, I'm sure you were under a lot of stress over the last couple of years. So how do you basically manage your stress levels? So what is your mantra for this?
Actually, there is no real mantra. We just got to go with it. It was a lot of actually emotional journey, because we have seen patients leaving their last breath in front of our eyes. And so every day was a roller coaster. Every day, right from the morning to the time we sleep, we hardly had any sleep for 1.5-2 years, peaceful sleep. But there is actually no stress buster. You just got to give your best. You don't really have time to think of stress relaxation and all. That was a real dark period in the period of for all the doctors and the paramedical staff in our country, I believe.
So doctor, who was your inspiration behind your successful story?
My real motivation and my mentor has been my teacher in my PG days. She was Dr. Usha Rani, our associate professor in pulmonology. She has been guiding me and many others like me throughout our MD course, and not only in pulmonology but also in various aspects of life, and how do we need to practice, what we need in practice, how do we need to update ourselves, and what kind of demeanor we need to carry about when we are dealing with patients. And what not everything in pulmonology, and basically her passion for pulmonology has brought a lot of passion for us into pulmonology, and she is our motivation even today, and we consult her for any doubts, or for any kind of whenever we feel low and stressed and we are in dilemma. Many myself and many others like me also talk to her and get relieved. There are some teachers like this who are real motivators, and every doctor has a mentor and a motivator for inspiration, and these are the kind of people who make run us, and in turn serve the society.
Well, I think that's inspiring to know that a female physician was your inspiration, because I don't think we get to hear this more often. So, doctor, let me ask you a basic question first. I'm sure most of the patients you see in your OPD are referred by other specializations. So, when do you think one should seek a pulmonologist opinion right away?
Yes, that's a very very good and valid question, basically, because see, most of the patients when they have fever, they consult a nearby general practitioner or their family physician, or a general practitioner, because uh, everybody thinks fever comes and goes in 3 or 4 days, or the max 5 days, and a small course of antibiotic would usually do the job. But if the fever is associated with just cough, cold, and some kind of sore throat, that is okay. It is usually called an upper respiratory tract infection. That's a URTI, which is very very common in children as well as in adults. But if it is persisting for more than 5 days, or within the first 5 days, if the patient is having a cough with a really thick sputum which is yellowish or greenish, and if the patient is having some kind of chest pain which is increasing on breathing or on coughing, that means that the infection has spread from the upper respiratory tract to the lower respiratory tract. So this usually happens in people who have lower immunity, patients who are diabetics, patients who are already diagnosed with COPD or something, or any chronic lung disease, or for that matter any chronic disease like the chronic kidney disease, or a heart disease or anything. So whenever there is associated chest pain which is increasing on breathing or coughing, which we call as a pleuritic chest pain technically, along with fever, or if the fever is not subsiding after 5 days even without these symptoms, if the fever is not subsiding with antibiotics, if it is taking longer to subside, then definitely they have to consult a pulmonologist, because lungs are always a focus of infection, and we never know until we take a chest x-ray and see after we examine them. So most of the times there will be a delay by the time the diagnosis is made, and the pneumonia usually spreads very fast, especially in those patients whose immunity is low, or whose immune status is bad. So that's the reason fever plays a very big role in the practice of pulmonologist.
Well, I think that's well said as far as fever in pulmonology is concerned, because I'm sure most of the patients present to you at a later stage and the disease must have been complicated already. Do we encounter this more often?
Yes, we do encounter such cases where the diagnosis have been late, and it is really a bad situation for us, because it will take a lot of time to recover those patients. It will take sometimes we may not be able to save the patient also. It depends, it varies from patient to patient. Some patients who are young with good immunity, they recover. Some patients who are, in spite of being young and with good immunity, they do not recover. The pneumonia tends to progress and they land up in the ICU requiring a ventilator. And in the elderly patients, and in patients who are diabetics or hypertensives, or with other factors which reduce their immunity, if these patients come late to us, our chances of recovering them, they go down basically. So the earlier the patients come to us and visit us, or the earlier they're referred, the better the outcomes will be, and we would be able to give our best.
So doctor, let me ask you one question. On a personal note, if not a doctor, what you would have been?
That's a tough question actually, but yes, even I have thought of this many times, but it was my childhood dream to become a doctor. చిన్నప్పటి నుంచి డాక్టర్ అవుదాం అనుకున్న స్కూల్ డేస్ అప్పటి నుంచి కూడా, అండ్ సమ్హౌ అలా వెళ్ళిపోయిందంత చదువు అంతా, అండ్ ఐ బికమ్ ఏ డాక్టర్. బట్ మేబీ నేను డాక్టర్ అయి ఉండకపోతే మేబీ జర్నలిజం అండ్ జర్నలిస్ట్ అయ్యి ఉండేవాడిని. బికాస్ యూనో మై ముత్తాత గారు అంటారు కదా, గ్రేట్ గ్రాండ్ ఫాదర్, హీ వాజ్ అ జర్నలిస్ట్ అండ్ he was a part of the freedom fight and freedom struggle, and he was a freedom fighter basically, and he started with journalism. He did it with journalism, like he did it with his pen and not the sword. So I always believe a pen is mightier than the sword, and so నేను కూడా మేబీ నేను జర్నలిజంలోకి వెళ్ళి ఉండవచ్చు. అండ్ I also believe that journalism matters a lot. మన యాజ్ అ హోల్ మన సొసైటీ తాలూకా స్టాండర్డ్స్ పెంచేదానికి కానీ, లేకపోతే మన సొసైటీకి జర్నలిజం అనేది ఇట్స్ లైక్ ఎ పిల్లర్, అండ్ మేబీ ఐ వుడ్ హ్యావ్ గాన్ ఇంటు జర్నలిజం.
Well, I think that's interesting and inspiring, because I haven't come across any doctors who said that they wanted to take up journalism if not for a doctor. So I'm sure every doctor has their own individual approach towards their patient. So what is your kind of approach, doctor?
ఒక పేషెంట్ మన దగ్గరికి వస్తున్నారు, దే హ్యావ్ ఎ ప్రాబ్లమ్ అనుకున్నప్పుడు వాట్ ద నీడ్ ఫ్రమ్ అస్ ఈజ్ జస్ట్ నాట్ ట్రీట్మెంట్, బట్ ఎంపథైజింగ్ విత్ దెమ్, పేషెంట్లీ లిజనింగ్ టు వాట్ దే సే. బికాస్ ఒక డాక్టర్ దగ్గరకు ఒక పేషెంట్ వస్తున్నారు అనుకుంటే వాళ్ళు బుర్రలో చాలా పెట్టుకుని వస్తారు, చాలా చెప్దాం అనుకుంటారు. అండ్ it is always important for a doctor to give time to the patient, let them talk, let them just finish them, let them finish whatever they want to say, and then maybe we can tell what is their problem, and we can give a solution to them, and we can advise them whatever needed. But I feel that most important part is trying to empathize with them. వాళ్ళు చెప్పింది పేషెంట్గా విని వాళ్ళ అప్రహెన్షన్స్ని మనం బస్ట్ చేసే విధంగా ఉండాలి, అండ్ దట్ టు ఇన్ ద మోస్ట్ అమికబుల్ వే. బికాస్ there are different kinds of people with different modes of expression, with different kinds of communication skills, and as a doctor we should never go into an offensive mode, because not everybody has good communication skills. They cannot వాళ్ళు చెప్పాలనుకుంది సరిగ్గా చెప్పలేకపోతారు, and they have their own way of saying things. సో యాజ్ ఎ డాక్టర్ మనం వీటికి అలవాటు పడి వీ షుడ్ బీ a level ahead in trying to understand them, and getting whatever information we want అనేది కూడా మనం అడిగేది కూడా it should be pleasant to them. Sometimes the patient doesn't require any investigations, any treatment. Basically what they require is just some reassurance. They come for reassurance, so reassurance plays a big role.
Well, I think I couldn't agree more, because I'm sure that most of the times patients, what they require is reassurance and not any investigations or treatment. So before ending this episode, what message you would like to give to the public out there?
Yes, I really would love to give a message to the public, because recent times in the sense in the past decade lo we have seen that the social media and the internet has taken over many things in our life. In the same way it has taken over the medical field also అనిపిస్తుంటుంది, and it is good to know for the patients about their disease, about their symptoms, and what they should follow, what they should not follow. Maybe social media and the internet can help them in to some extent, but completely relying on social media and losing faith in doctors, and not following doctors' advice, and not consulting the doctor until things have really gone really bad, following different kinds of diets and other techniques to reduce their symptoms, or for that matter whatever medical condition they are having, is actually not right. Me as a doctor personally have seen so many patients who have really wasted time in all this, and finally realized that meeting a doctor is the most important thing, because most of the times patients అనుకునే దానికి వాళ్ళకు ఉన్న దానికి చాలా వ్యత్యాసం ఉంటుంది, and when they meet a doctor everything changes. Sometimes what the doctor advises can be found in the internet, but not the whole medical field is in the internet, and internet should not be the solace or the destination for any patient, and the doctor should be a destination. And medicine is a very very vast field. మనకి జరిగినట్టు ఇంకోళ్ళకి జరగకపోవచ్చు, వాళ్ళ స్టోరీ వేరవచ్చు, మన స్టోరీ వేరవచ్చు. వాళ్ళ కండిషన్ వేరే అవ్వచ్చు, మన కండిషన్ వేరే అవ్వచ్చు. సో కంపారిజన్స్ ఎప్పుడు కూడా మంచివి కాదు మెడిసిన్లో. మన ప్రతి బాడీ హ్యాస్ ఇట్స్ యూనిక్ సాఫ్ట్వేర్ అండ్ హార్డ్వేర్. ఒక్కొక్కళ్ళు ఒక్కొక్కలా రెస్పాండ్ అవుతారు ట్రీట్మెంట్కి, జబ్బుకి, వాట్ సిమ్టమ్స్ పరంగా కానీ. సో మీరు ఉన్నట్లు ప్రపంచంలో ఇంకెవరు ఉండరు. సో కామన్ జనరలైజ్ చేసుకుని అనవసరంగా డోంట్ వేస్ట్ యువర్ టైం, ఎనర్జీ యాజ్ వెల్ యాజ్ మీ ఇంటలెక్చువల్ దీన్ని అనవసరంగా పాడు చేసుకోమాకండి. అండ్ వెన్ ఇట్ కమ్స్ టు మెడిసిన్ ఆర్ మెడికల్ అడ్వైస్, యూ బెటర్ కన్సల్ట్ ఎ డాక్టర్ దాన్ ఎనీథింగ్ ఎల్స్. That's my only advice.
So thank you, doctor. It was wonderful talking to you.
Sure. Thank you so much.
So this brings us to the end of this episode. Hope you all enjoyed watching us and do join us for the next week as well. Thank you and take care.